I've been joined by a health worker who was part of contact tracing teams during the height of the COVID-19 pandemic here in Ghana. He has been gracious enough to speak with me. I'll call him Papa for the purpose of this conversation for obvious reasons. Thank you, Papa, for joining me. Now, I want to find out, when did you first begin the contact tracing process?
The contact tracing actually started on the 1st of April, as the President of the nation had announced. And to our understanding, we were doing the contact tracing until the cases were down. But we were later informed that the contact tracing was just from 1st April to 19th of April. But for my district, we had worked even after the 19th of April, even to somewhere 3rd June, around 4th June, because we had a meeting with our director regarding the monies that were not being paid on 4th of June. So from the 1st of April to the 19th of April, we had received all our monies that we had worked for. But from the 20th of April through the whole month of May till almost the 3rd of June, we have not received any payments, only to be informed that the contract was to end on the 19th of April. And we're like, how? We were working all this while we were taking the data and people were risking their life to work, and realize the case, they inform us that it was just ending 19th. What have we not said about our monies? It's just unfortunate.
No, the situation you tell me about, is it the same with your other colleagues in other contact tracing teams in other parts of the country, say in the Ashanti region, the Eastern region, the Volta region, and all these other parts of the country?
See, when we were demanding for our monies to be paid, for all the extra days that we had worked to be paid, our colleague contact tracers in Kumasi, in the Ashanti region, were also facing the same challenge. They had also worked for some number of days after the April 19th. And their regional health director was up to task, and he ensured that the contact tracers in his region are paid, and they were duly paid. But what of Accra? What happened to Accra? We are saying that about 75% of the cases are in Accra. Yet still, the people who are going for the samples, getting the contacts, doing the tracing, were not even paid. It doesn't make sense. What of us, Greater Accra?
It must be frustrating and hard for you and your colleagues.
It's bad. We go to the office on several occasions. You go and they tell you a different story. You go, they refer you to go back to your district director. You go back to your district director. He tells you this rhetorics. Okay, they are working on it. Nothing is being done. We are in 2021, January. Nothing is being done.
Now, I remember an elaborate announcement, series of them actually, were made by the President and the Ministry of Health, the Ghana Health Service, regarding some insurance packages, tax waivers, etc. for health workers, especially those who contract the disease in the line of duty and stuff like that. What happened to those?
Komla, on paper, there is a health insurance package for frontline workers who got infected in the line of duty. I can speak for myself and some few colleagues of mine who got infected that I know. None of us, not even a single one of us, have received our insurance packages. As at May, June, July, none of us have received any of the insurance health packages. So how do you expect us to go back to the field when we now see that the cases are rising? Well, it's in their hands. They are our leaders. It's in their hands. We look up to them. If they will sit on our monies that needs to be paid us, that's to them.
So what are you doing now? You and the others who were doing the contact tracing, because since April, or since June in your case, July, August, September, October, November, December, you've not been doing contact tracings. What have you been doing now?
We have returned to where we came from. So we are still, though we've not finally been posted to our various facilities, we are still waiting. Okay, so if they call on us to get into the contact tracing again, we will be glad to do that, but on new terms and conditions. Our previous money should be paid to us.
Let's get into when you were infected, okay? I know some of your colleagues were also infected. Some of them were unfortunate, they passed. How did you cope?
Kamla, I was a contact tracer and I got infected in a line of duty. There is a package for the health workers. I mean, the first one is a temporary illness or something. The second category is critical illness. And then the third category is if you die as a result of the COVID-19 as a health worker in your line of duty. Okay, we know health workers who have died. We know health workers who got a critical illness as a result of the COVID-19. And we know health workers like myself who had a temporary illness because of the COVID-19. Our names and informations were taken because I wasn't only the one in my district who got infected. There were other colleagues of mine who also got infected in a line of duty. Our names were taken by the director with his team and forwarded to the regional level. That's the end. Are they just interested in the data so that they can talk, well, 75 health workers got infected, 25 lab people got infected, 30 nurses got infected, 25 doctors? I mean, for what? Where is the insurance package? I'm just thinking about my senior colleagues and my colleagues who lost their lives in a line of duty due to the COVID-19. I'm just thinking about what their families are going through. Have they been compensated? Myself, I've not been compensated. Likewise, my other colleagues, none of us have been compensated. It's more or less like a scam, like a 419 health insurance. It's bad.
Is this something you would do again now, knowing that government has said that it is now mobilizing some health workers to recommence tracing of contacts as we see a spike in cases?
Honestly speaking, as a health worker now, I'm not sure I would want to get myself involved in anything that has to do with this infectious disease. I wouldn't. I want to risk my life again. Aside all the other things that we had to go through in our times of isolation and quarantine, it's something else. Even as a health worker, no one is ready to even take care of you. How much, the other people who are not health workers, it's very pathetic. The system needs to be really upgraded and things really need to be looked at again.
Thank you, Papa, for speaking to me on this. Grateful.
I strongly trust in your media and your personality that this information will get to the right people in authority and then something better will be done regarding all the issues and concerns that I've raised.